Hey folks, let's talk about this new randomized controlled trial published in the New England Journal that tells us that there are many people out there walking around with respiratory symptoms who have undiagnosed chronic respiratory disease, asthma, or COPD. And if we find them, we can actually make them better, healthier. Let's talk about it. So off the top, I'll start by saying that I'm conflicted because I was part of this study, but I think the result is really interesting. So what we did is we random digit dialed over 1 million Canadians to see if anybody out there would volunteer that they have respiratory symptoms and be willing to do a questionnaire. And we called back whoever was willing to be contacted and asked standardized questions about respiratory symptoms. We administered that questionnaire to about 40,000 people and ended up bringing about 3,000 people into the lab to be tested. And about 20% of those, in this case about 600 people from around the country, had either asthma or COPD, the two most common chronic respiratory conditions. So these are people who were out there in the community who did not have a previous diagnosis of asthma or COPD, and that's what's really important here. Then we took those patients and we randomly assigned them to either get the test result and go back to their family doctor, or to see a specialist like myself and a specialized educator around respiratory disease and receive that guideline-based care. And what the study showed was that whether you went to your family doctor or the specialist, in both cases, you had better symptom control, less symptoms, and a better quality of life. If you ended up seeing the specialist, you had an even better quality of life, even less symptoms. You needed the healthcare system about half as much over the next year for respiratory symptoms. So in other words, less visits to the emergency room, your family doctor, walk-in clinics, probably because of better symptom control. And you had a larger improvement in your lung function. So bottom line is that knowing you had this diagnosis means you did better, whether you saw your family doctor or a specialty clinic. But if you ended up seeing a specialty clinic, you did even better. So we've always known that there are a lot of people walking around out there with asthma or COPD, but they don't have a diagnosis. What this study tells us is that not only can we pretty efficiently identify who they are, but it matters to identify them, because if we identify them early, we can treat them and improve their outcomes. And so the next question is, how do we make this a reality? How do we get the right people to answer the right questions so that we can identify them, test them, and then treat them? And that's the next step that comes out of this study. But what's really exciting here is that we know that we can improve the health of people with undiagnosed asthma or COPD. So if you have respiratory symptoms, see your doctor, ask for a lung function test called a spirometry, and see if you have one of these conditions and need treatment.